My name is Lee Carden, and I'm a project manager at Syntasa. I work with the engineering and innovation teams to deliver projects in the public sector. We've been working with various state governments and agencies to help them tackle some of the biggest challenges that they've faced since the start of the pandemic. This includes things such as mental health and substance abuse issues, the delivery of social services, as well as the fast and equitable distribution of the COVID-19 vaccine. More recently, we've had the privilege of working with Google and the UK Cabinet Office to help support the G7 in its mission to increase vaccine confidence around the world. We want to show you a little bit about the work that we've been doing and explain that and give you a behind-the-scenes look into how we're doing it.
My name is Sean Zargam. I'm Chief Technology Officer of Syntasa. I've been here from the beginning, one of the co-founders. Our focus was to look at hesitancy and acceptance of vaccine globally. There were some conversations around what hesitancy means or whether or not different people look at it differently. So we ended up settling on the people that are in the middle, neither the rejectors or acceptors. The initial top-level dashboard that we focused on was a global dashboard that showed who the undecided cohorts are for various countries and showed the percentage of undecidedness, showed geographical maps that showed the difference between different countries. And from there, people could zoom into a country-level dashboard where they could see different metrics by cohorts, age groups, by gender, ethnicity, looking at whether or not they lived in an urban or rural area, and various other type of data that we could source from different places. One of the big focuses of the project was also looking at the social media activities and the general media and news activities around the world, and to see if there are correlations and relationships between the narratives that are out there and the level of hesitancy, and also looking at how vaccination in general, as the uptake of vaccination happens, what sort of narratives people are talking about. When you get into situations where you're trying to move the needle perhaps on hesitancy, there are different parties that are involved. We've worked with media agencies where they wanted to have a data feed at the various geographical level, zip code level or DMA level, defined marketing areas in US. We've worked with organizations that are focused on helping people on the ground level, trying to look at what people are doing, and more like a campaign. They're trying to influence and help understand the challenges that people are facing.
Hi, I'm Charmi Patel. I lead the innovation and data science team at Syntasa. When we start with the social data, typically what happens is social data has a lot of data. So it's very messy. People are saying a lot of random things. And the first thing to do is to really understand what can we infer out of it, what will be meaningful, what can we even do on this data, and which kind of data modeling techniques or data science techniques would really benefit in the longer term perspective of our project. One of the things that we're really looking for is what are people talking about. And if we start with the idea that some of the stuff that they're saying revolves around certain topics, first thing that comes to mind is trying to use topic modeling techniques to come up with underlying topics that people are really talking about. Some of those may be very positive, some of them could be negative, and that leads us to the second thing to do, which is a little bit of sentiment analytics on top of already gathered chatter. This was a pretty large project with a lot of people involved and very tight deadlines. And that meant that we had to have a lot of people collaborate and produce their work on different kinds of aspects about the data. Had it not been for some of the concept that Syntasa platform bakes in the concepts of apps, the concept of dev and production, and ability for people to share their apps with each other, the ability of the system to sort of self-document the lineage of the data as it is transforming, it would have been really difficult for us to have an end-to-end repeatable process that continues to work on a daily basis.
My name is Lindsay Williams and I'm the Consulting Director for EMEA, based here in the UK. The Syntasa software is installed in a dedicated UK Cabinet Office Google Cloud Platform project. This is our app flow view, which is a high-level visual overview of the pipelines that have been configured to ingest, cleanse and merge data from these datasets to ultimately power the vaccine confidence dashboards. These icons represent the source data apps. Google COVID-19 Open Data is an open source dataset containing data from around the world relating to various topics such as vaccinations, epidemiology, hospitalizations and demographics. Google Health Trends is health-related search data from Google. COVIDcast is a collaboration between Facebook and various academic institutions. Carnegie Mellon University conducts research surveys via Facebook to monitor the spread and impact of the COVID-19 pandemic in the United States. Similarly, COVID-19 World Symptoms Survey is a collaboration between Facebook and academic institutions. Surveys are managed by the University of Maryland and are conducted on a daily basis on a representative sample of Facebook users across various COVID-19 related topics. We make use of data from two premise surveys, one which records respondents' answers to questions related to the global impact of COVID-19, and another with responses to more general vaccine sentiment related questions. Signal AI monitors global news sources for articles related to the pandemic. Their powerful algorithms scan stories to identify sentiment related to the development, uptake and attitudes towards the COVID-19 vaccines. We have access to a sample of Twitter data where we have applied topic modelling to identify emerging themes in the social conversations from around the globe. And finally here, through Brandwatch, we have access to comments from posts on Facebook pages of news organisations from around the globe. Again, we've been able to model this data to identify key topics and sentiment related to COVID-19 vaccinations. You can see from the app flow diagram here that data from the separate apps flows into a single app. After analysing the various source data, including volumes, velocity and geographic level, we were able to design a consolidated schema to allow for the merging of key variables and metrics from each source that were required for inclusion, and it's the data configured within this curated data app that ultimately feeds the dashboards.